It's good to see you all. It's been months since we've had one of these state and federal policy updates. We took the summer off from webinars, although we have been very busy hitting the road and visiting different communities around Kentucky and doing all sorts of other work during the interim. But it's nice to be back here to provide you all with some updates. And if you all aren't familiar with me or with Thrive Kentucky, I'm Emily Beauregard. I'm the Director of Kentucky Voices for Health and a member of the Thrive Kentucky campaign. And like I said, it's been a few months since our last webinar. We had been doing these every month for quite a while. We took a break. I think the last one was maybe April, and then we had a forum with the Cabinet for Health and Family Services in May. And so we've got lots of updates for you today about the legislative interim, upcoming elections, along with the usual state and federal policy updates and everything that you need to know about the status of Kentucky's safety net programs. I know most of you, let's go to the next slide, Alex. I know most of you are familiar with Thrive Kentucky by now, but if you're joining us for the first time, our mission is to meet the basic needs of every Kentuckian through systemic change, because we recognize that many of our fellow Kentuckians have faced historical and systemic barriers to meeting their basic needs. And you can see the principles that guide our work on this slide. Now, I realize that that's a lot of text. You'll get these slides and the recording and other materials all in a follow-up email, so you can take a closer look whenever you have a chance. We can go to the next slide. If you want to know more about any of our particular organizations that are part of Thrive Kentucky, these are hyperlinks to our organization's websites, and you're welcome to learn more there. Before we begin, just some quick housekeeping. We have a lot of folks on the webinar today. So please be sure to mute your line. We're also recording, like I said. We'll be sending out the recording and any materials along with an evaluation and a follow-up email. So watch for that tomorrow or Wednesday. Tomorrow would be Wednesday, wouldn't it? It's tomorrow or Thursday. And if you're a certified community health worker or a social worker and you'd like to receive CEUs for attending today's webinar, there'll be more information in that follow-up email, but you will absolutely need to take the evaluation. We want feedback from everyone, though. So we can move on to the next slide. We always like to say thank you to our sponsors for making it possible for us to do these webinars and other Thrive Kentucky events for free and for offering these CEUs. We really appreciate it. If you want to learn more about potentially sponsoring Thrive Kentucky's work, you can reach out to Kelly and she can put her email address in the chat as well. And let's go to the next slide. So I mentioned we've been busy on the road, visiting different communities. We do a 3-hour session when we go in person with our Thrive Kentucky Advocacy for Thriving Communities training. And if you're interested, hopefully some of you have already been able to attend one and we've gotten to see you there. If you haven't yet, here's the rest of our schedule for the year. We'd love to see you, or if you want to share this information with colleagues, please do. But this is a really good opportunity to dive even further into some of the different topics that we focus our work on. We can go to the next slide. Here's the agenda we're going to be covering this afternoon. During each section, you can put questions or comments in the chat. We'll try to cover those as we go, so you don't have to wait until the end if you have a question. And if we have more questions than we can get to in the next 90 minutes, we'll be sure to share any answers in that follow-up email that I mentioned. So don't let that stop you from putting your questions in the chat. And we also really like to connect with folks. So all of our contact information is at the end of the slide deck. And with that, I'm going to turn it over to our first speaker, Dr. Sheila Schuster.
Thank you, Emily, and good afternoon, everyone. I'm Sheila Schuster. I'm a licensed psychologist, and I run the Advocacy Action Network, which is composed of the Kentucky Mental Health Coalition and the 874K Disabilities Coalition. Next slide, please. So you've heard about the interim session. You know, it used to be in the olden days that when the legislature went home in April, nothing much happened until they adjourned or reconvened in January. But in the last couple of years, especially the interim session has gotten busier and busier and more important. So the interim is the session that meets between June 1st and early December. And while they can't pass any legislation, they use that time to study issues in greater depth, to revisit issues from the previous session, and most importantly, to preview issues that may be heard in the upcoming legislative session. So just a reminder that the House and Senate committees meet jointly every month. So as an example, the House Health Services Committee and the Senate Health Services Committee have been meeting together since June. They had one meeting during the state fair, but they met in Frankfurt and not at the state fair, which was better for those of us who are monitoring it. And if you want to contact them in terms of getting on the agenda, they alternate between the House chair and the Senate chair, doing the duties of chairing and taking responsibility for selecting the agenda. It's a great time to take an issue that you're looking at that may be in health or maybe in education or maybe in local government and vet it, because you can reach members of both the House and the Senate committees at the same time. Next, please. So it's a great time also just to make contact with legislators in Frankfurt or at home, because they're not so darn busy as they are during the regular session. I would suggest that you follow up from any newly elected or re-elected legislators from the May primary, congratulate them, introduce yourself, and begin to establish or to strengthen your working relationships with them. The other reason that the interim is so important is that a few years ago, the General Assembly leadership decided not to make public what we used to call the pre-filed bills. And they gave us a preview, actually, of the legislation for the upcoming session. So it's become more of a detective game at this point, where we have to kind of follow very closely the interim discussions and to then monitor in order to get a sense of what the legislators are working on. Now, some of them are presenting their own bills for the upcoming session, and so that's pretty obvious. But otherwise, it's again really helpful to talk to legislators who are working in an area that you're interested in to see if there's any legislation brewing. And just a reminder that the next session will convene on January 7th, and it will be a very short session, a 30-day session. So that means you've got to really have your ducks in a row. Kelly's pointing out 125 days, so it will be here before we know it. Next, please. The other important thing about the interim session, and this again has been a relatively recent development, is that special committees known as task forces are appointed, and they will look at a single topic, although they may look at it in a lot of different perspectives and ways. And they look at it in order to make recommendations for future action, possibly in the upcoming session. So you could go to the LRC website, thelegislature.ky.gov, and look for committees, and then click on the special committee tab. And this is where you'll see these. And you can see the minutes of the previous meetings. You can see all the materials that were presented at that meeting. So I've listed for you here the remaining meeting dates for each of the task forces. So most of them, as you can see, are going to meet September, October, November, and then they'll wrap up in that November meeting and have their recommendations, if they're going to have formal recommendations, ready in December. The other one I would point out is this Efficient and Effective School District Governance Task Force. It's already had one meeting in Louisville so that students and parents and teachers and interested citizens could come to Central High School and share their information or their perspective on JCPS. So the next one, and the only other one, will be September 10th. That's next Tuesday at 5:30 at Male High School. And they're asking for people to comment on what programs or what changes and offerings would you like to see. But obviously people are also weighing in on the topic of whether JCPS should be split up into smaller districts. So that's a golden opportunity for you to come and have your voice be heard. Next slide, please. So the other thing that's happening during the interim is that we're seeing legislation that was passed in the 2024 session get rolled out or implemented. And one of the things that we followed very closely, and that many of the organizations and Thrive, probably all of us, were supportive of, was a bill that Representative Moser filed called the Omnibus Bill. It started out as House Bill 10, but it actually passed as Senate Bill 74. And there are some really, really exciting things. So just to name a few, there's now lactation consulting and supplies that are available both pre and postnatal. There's going to be a Kentucky Lifeline for moms. As a psychologist, I'm particularly interested in this. Mental health professionals, either a psychiatrist or a psychologist, are going to be available for consultation with providers to help them walk through care for their patient. There's going to be referrals and care coordination for moms, and then additional training for providers in how to recognize what we call perinatal mood and anxiety disorders that affect both moms and dads, actually. There also is going to be a required study for doula care in Kentucky. Has to be done by this December, and there may be an opportunity for input opportunities. So follow KVH for some, stay tuned for that. The HANDS program, which has been around for 20 years or more, is extended now through the child's 3rd year, and there's telehealth option has been added. And then most importantly, maybe, is that pregnancy is now considered a qualifying health event for the mom to get enrolled in insurance. And so that's in a special enrollment period. So the mom who is uninsured does not have to wait until that next enrollment period, regular enrollment period. So we want those moms to have coverage for sure. So we're very excited about that. Next, please. Let me shift to the other way that you could participate in the democracy. One way, of course, is to raise your voice and to speak out. The other is with your vote. And it's not just your vote, but remember, you can influence others to vote and make sure that they are registered and so forth. Next slide, please. So 2024 is an important election year. You may have heard that we're having a presidential election. The airwaves are already full of ads and so forth. So we'll have the presidential election. We'll have all 6 Kentucky congressional races will be on the respective district ballots, plus 45 Kentucky House seats and 8 Kentucky Senate seats. And then some ballots in some localities will also have judicial races and local office holder elections. So lots of important votes to be cast. It's never too early to make sure that you and your community members are registered. The one-stop shop is govote.ky.gov. You can check on your own registration and you can register online. The general election is November 5th, which is roughly 2 months from today because it'll be on a Tuesday. The registration deadline is a month earlier, so that's October 7th. So don't let that sneak up on you. And then if you look at our resource section later on in the slides, but also delivered to you in the next couple of days, there's a KBH voter guide there. And let's remember that elections have consequences. The other thing I would point out is if you have someone in your family or know a kid who is going to turn 18 before or on November 5th, they can go on and register now. So don't hesitate to get them registered. I have one more slide on the elections. So I want to point out that there is Constitutional Amendment 2. This does not have to do with guns. When you hear about Amendment 2, people immediately think about the US Constitution and the right to bear arms, but this is the Kentucky Constitutional Amendment. It would alter Kentucky's Constitution to allow state funds to go to private schools rather than to stay strictly in funding our public schools. It actually waives, I think, 7 different parts of the Kentucky Constitution to make that happen. It's being called a school choice vote, but the majority of Kentucky counties, I think 63%, have no private school option to choose. And the thing I would point out as someone who has worked with students with disabilities and students in need of mental health care, private schools do not have the same requirements or accountability as the public schools to serve students with disabilities, nor do they offer the same mental health resources. So more information available on that. And again, remember that the general election is November 5th and the voter registration is October 7th. And elections really do have consequences. And with that, I will wrap up and turn over to my friend Dustin Pugel.
All right, thanks, Dr. Schuster. My name is Dustin Pugel. I'm the policy director at the Kentucky Center for Economic Policy. We're a nonpartisan nonprofit research and advocacy group and eager member of ThriveKY. So each time we like to start with sort of an overview of where the economy is, because we're going to talk a little bit about food assistance, medical assistance, housing assistance, and other things that really the extent to which those things are needed is based off of how well people are doing economically. If you've got a good paying job and you can cover your expenses, those aren't really necessary, but we have a safety net to catch people when they do need it. So starting out just with where we are with employment, we are still in the midst of a really incredible historic recovery. It's the most rapid rate of job growth that Kentucky's seen in decades. And that's coming out of a really, really significant hole back in 2020. But at this point, we've regained 382,000 of the 294,000 jobs that we lost, which means we're now around 80,000 jobs above where we were pre-pandemic, or around 4.5%. This has been a really great and strong recovery. And if we move to the next slide, a lot of that has to do with a lot of federal investments. So if we think about back to 2020 all the way through until even still today, there were a lot of sort of bills in Washington, D.C. that sent billions of dollars, $45 billion to be exact, to communities and individuals here in Kentucky through stimulus checks, boosted unemployment benefits, direct state and local aid, including to childcare centers. We'll talk about that in a little while, and other things. And that really helped get us on our feet. But right on the heels of that, we also saw really large investments in our infrastructure and other really important parts of our economy. And so specifically, the Inflation Reduction Act, the Bipartisan Infrastructure Law, and the CHIPS and Science Act have led to hundreds and hundreds of projects here in Kentucky, improving things like our roads and bridges, our internet infrastructure, cleaning up abandoned mines and orphan wells, and then building new manufacturing like the 2 battery plants that we're working on right now. The upshot of that is that construction hiring in particular has really been strong. And that's really good because those are jobs that we need not only to make sure that people can make ends meet, but because there's a lot of things we need to build here in the Commonwealth. And so having a well-trained workforce that's ready to go here in the state is really important long-term to us being able to provide for all the construction needs that we're going to have. Other sort of standout sectors, if you look at this chart on the right, the red bar represents what's going on nationally. The pink bar is what's happening here in Kentucky. You'll notice that things like trade, transportation, and utilities is much higher. So think of delivery folks and folks who work in warehouses. Education and healthcare has been much higher. I think part of that's due to the fact that we have Medicaid expansion. A lot of other states don't. And you'll see that we're sort of lagging as well in some instances, particularly in government. We'll have more to say about that here in a little bit. So let's move on to the next slide. Now, that job growth has not been consistent across the whole state, as is usually the case. What's interesting about what's happening right now is typically Eastern Kentucky is lagging behind, and indeed it's still lagging behind from, say, the Great Recession. But if we just look at what's happening in 2019 versus now, most areas in the state are doing pretty well, especially around Bowling Green and Northern Kentucky. It's really just around Owensboro where we haven't seen as much job growth. So this sort of meets the typical trend in Kentucky that urban areas tend to be where a lot of the job growth is. And this right now is no exception. Let's move on to the next slide. Now, just because you have a job doesn't necessarily mean you can afford all of your needs. And I'm sure everyone on this call has felt the reality of rising prices. particularly in housing costs, in vehicles and new and used cars, and in food. And that's something we notice every time we go to the grocery store. The good news is that the increase in prices has fallen a lot. So things are not getting as expensive as quickly, or anywhere near as quickly as they used to be. The bad news is things are still more expensive than they used to be. Now that's settling down, and I think that sort of pain of increased prices will start to dissipate as we move forward. But what that also means is that the Federal Reserve is very likely to start reducing the benchmark interest rate, which is what all the other interest rates are based off of, particularly mortgages, car loans, and credit cards, especially variable rate loans like that. So, that means that ideally, hopefully in the near future, things like buying a home or another car for your household is going to become slightly more affordable. So we're supposed to hear new news on that in the coming weeks. So I would just say stay tuned. Ideally, that's going to probably hit next week or the week after. So let's move on to the next slide. Now, this has all been about sort of what's been happening in the private economy more generally, but we also know that Kentucky has its own budget, its own sort of needs as a state, and our own way of funding those needs. So this past session, Kentucky passed a new 2-year budget. And as I say, in just about every setting, the budget is a moral document. It's a statement about what we value. And generally speaking, I think in Kentucky, we value some really good and important things. So particularly this year, if we look at what changed for the better, we got a lot of more spots for Medicaid waivers. I know a lot of folks on this call worked hard on that, or at least were very closely following that. We got 1,925 new spots in Michelle P., SCL, HCBS, and one of the, I think Dr. Schuster, was it Model 2? Or was it long-term care acquired brain injury?
Model 2.
Model 2, right, okay. So, that's a lot of spots. That's more than I think we've ever seen in a single budget. It's spaced out over 2 years, and it's so many that I think the state is trying to figure out how they're going to find enough providers to provide the services for those slots. So we'll have more updates in the coming months on how that's going to roll out, but that's good news. State workers also saw a salary increase. That was really important because there was a lot of turnover in state government. It was really difficult to keep people, particularly as there's no defined benefit pension plan anymore. So those salary increases were very badly needed, particularly with the inflation that we've seen in recent years. There was new funding for childcare. I'm going to say more about that in a minute. There was slightly better post-secondary education funding, which has seen a long-term decline in state funding. So reversing that trend is really, really important. And there was also improved funding for school transportation, which had hit roughly half of what the state was supposed to be putting into it, and led to a lot of really serious problems with bus routes. I think everyone remembers Jefferson County a year ago. Some things were sort of leveled off, maintained. So particularly base funding for Medicaid was held harmless. That's something we were really worried about. Partway through the session, they were shorting it, and there was a potential of a $1 billion shortfall, like what we saw in Indiana. The General Assembly caught that, turned around and fully funded it, which is great. They also didn't cut K through 12 education funding. It's still about 25% below where it was in 2008, but at least compared to the last biennium, when you adjust for inflation, it was leveled out. What was cut or left out? A few things. First of all, housing was badly shorted. There's a very, very large unmet need in housing that the state has the ability to fill, particularly with the amount of money we have in our Budget Reserve Trust Fund and the surpluses we've seen in recent years. Adrian will say a little bit more about that need, but suffice to say that there was some new money for that, but not nearly enough. Emergency funding was capped for the first time. So anytime there's a natural disaster or another similar type of emergency, the governor has an ability to spend what's needed. And then later, when the General Assembly comes back in to fund that, this time they capped it at a certain amount, which would require a special session in order for the governor to continue spending during something like, another round of tornadoes, or God forbid, another large flood or an ice storm. And that's something that we've never seen before. So it's not quite sure I think a lot of folks are kind of wondering how that is going to play out in the future. And then finally, there was money in the previous budget to set up a system of mobile crisis units across the state. And there was widely expected that there was going to be funding to actually implement that this time. The General Assembly cut that from the governor's budget and then ultimately didn't fund it at all. So unfortunately, we had a system of mobile crisis units for things like mental health crises, where we could get trained experts to come instead of police to deal with those instances. And unfortunately, we had to cancel the contract that was set up to be able to provide those. So let's move on to the next slide. Typically, what we see is essentially one executive branch budget document. It's one bill, and it has all kinds of ongoing needs, as well as some sort of one-time expenses. This year, however, the General Assembly decided to split that up. And so they had a sort of what they considered an operational budget, but then also what they considered a one-time need budget. Really, there were two of them, the House Bill 1 and Senate Bill 91. They did slightly different things. But the upshot is that it was $2.9 billion in new spending, and that spending was going to come directly from our state's savings account called the Budget Reserve Trust Fund, sometimes called the Rainy Day Fund. And this included hundreds of projects. Most were local, but some were statewide. And the real question was, why split this into two different budgets? Why put this in a separate bill? So let's move on to the next slide.
Okay.
Oh, I think we're missing. I think we're missing this. Actually, go on one more slide, and we'll come back to that one. The reason is that there has been an effort over the last several years to cut our state income tax. More recently, legislative leaders have said that they want to go to a 3% income tax. We had been at a 5% income tax before this started. And the way to do that is you have to underspend, right? You have to underspend and you have to put more into the Budget Reserve Trust Fund. So in this second budget document, what they said was all of this spending doesn't count toward our triggers that we have for ourselves to be able to reduce the income tax. Well, reducing the income tax not only means that the state is underspending, and that's one of the reasons why we've had a surplus for so many years, but it also reduces our ability to spend in the future because it's very expensive. So, for example, going from a 5% income tax to a 3% income tax may not sound like a lot, but that's valued at $2.7 billion. Just a reminder, the state only spends about $15 billion a year. So that's an enormous amount of money that we could be using for a lot of different things. To put that in perspective, spending $2.7 billion on an income tax is more than we spent on Medicaid, which is about $2.5 billion. It's more than we spend on base funding for our K through 12 education system, which is about $2 billion. And it's certainly a lot more than things that we know we need that we're losing, like federal funding for child care centers, which is about $330 million. So it's a very expensive cut, and it really doesn't benefit lower income folks. So let's move on to the next slide. If you look at the result of a 1 percentage point reduction in the income tax, the biggest winners are wealthier folks, and that makes sense because they're the ones who typically spend them or have higher income, so their income taxes tend to be higher. So for the top 1%, people who earn on average $1.4 million a year, we're talking about an $11,000 benefit in a 1 percentage point reduction in the income tax. If you look at folks who are in the bottom 20%, so our poorest earners, that's about a $20 income tax cut per year. It's very little. For the lowest income families in Kentucky, those below the poverty line, there is no benefit because they don't pay an income tax. What it does do, however, is again, reduces our ability to meet our public needs, and that's a real problem. Okay, I'm so sorry, Alex. Can we go up 2 slides? And then we're going to come back down. Another way in which we're really concerned that public education funding could be hurt is this Amendment 2 that Dr. Schuster mentioned earlier. Specifically, we're concerned that by waiving 7 parts of the state constitution, a constitution, by the way, that is really unique in the country in its ability to preserve public education for our state. It has safeguards in place that have prevented things like voucher programs in the past in Kentucky, and also did things like ensure that the Kentucky Education Reform Act was passed, which created the SEEK formula and reduced inequity between school districts. That constitution is now being proposed to be changed such that the General Assembly would be able to create essentially what are coupons for private schools. These are called vouchers. Sometimes they have other names, but more or less what they are is a $5,000 or $6,000 coupon to private schools. And if you look at what's happened in other states, these programs have become really expensive really quickly. So take Florida, for example, which is maybe the most egregious example. Vouchers make up 31% of their state education budget now. And that means that results in less money available for public school districts. If you applied a 30% reduction in state investment in public education to Kentucky school districts, you get this map on the right, which shows a reduction in overall funding between 21% and 5%. And no surprise, it's the rural counties who get hit the hardest. Now, urban counties still get hit by moving to a voucher-based system because, like Dr. Schuster said, while the majority of counties don't have a private school in them, I think something close to 80% of private schools are in 5 counties, and those are in Northern Kentucky, in Jefferson County, and near Fayette County and near Fayette County. Because we pay for schools on a per pupil basis, if you have a lot of students leaving public schools to a private school, you're also reducing the amount of money available in public schools. But public schools still have to heat their buildings. They still have to have a certain number of staff. They have a lot of fixed costs that don't change. So urban and rural counties get hit differently, but they both get hit under a voucher system. We're really worried about what this means for the long-term ability to provide for Kentucky's kids. Dr. Schuster mentioned through concerns of behavioral health provision, through being able to provide for kids with disabilities, but there's many other ways as well. I'm going to pause there and keep moving because we got a few other things to get through. So if you want to move forward a couple of slides. One area that we did see some improvement, but there's still more need in the state budget is in childcare. So we all know that childcare is the industry that supports all other industries. It particularly benefits women when women are able to find a safe, affordable, high quality place for their kids to be. They're much more likely to be in the workforce. It affects prime age workers who are the ones that you'll hear legislators talk about the most. These are folks between 24 and 55-year-old. So they're sort of in the prime of their working life. It affects them more drastically than younger and older workers. And frankly, 1 in 3 parents in Kentucky have had employment disruptions due to childcare issues. I put my kids in childcare. Sounds very familiar. It's certainly something that I've dealt with in the past. So let's move to the next slide. Unfortunately, childcare is difficult to find. And that is not a new problem. It's something that's been exacerbated over time. So there's been a 45% decline in the number of childcare centers in Kentucky between 2012 and 2024. That's close to 1,700 centers across the state. And even if it was affordable, which it's not, it still is difficult to find a place where you can place your kid regardless of quality. Early on, there was a moratorium in childcare assistance that resulted in a pretty steep decline in the number of centers who could stay open because childcare centers in rural parts of the state depend heavily on parents who are using childcare assistance. So when that pauses and there aren't parents who are able to use it anymore, that really hurts them. So just keep that in mind when we talk about what's been happening with federal funding more recently here in a little bit. But starting in 2020, $1 billion was invested in Kentucky's childcare industry that wasn't there before through 4 different federal packages. And that really stabilized things. So we've really been holding steady at around 2,000, 2,100, somewhere in there, childcare centers for the last 4 years, which is great because, like I said before, we've been falling pretty much for 10 years prior to that. So let's move on to the next slide. Again, it won't be any surprise that there are 1 in 3 counties are a childcare desert, meaning there are 3 or more kids looking for every spot. In some counties, like Martin County, there are no childcare centers. So we don't have enough capacity to be able to find placements for every kid, let alone high quality placements, which are really important. Let's move on to the next slide. And even if you could find a place, it's still really difficult to afford. So full-time average infant childcare at a center here in Kentucky costs about $9,700 a year on average. If you compare that to full-time tuition at a community college at $5,300, that community college seems like a bargain. If you look at full-time tuition at EKU, it comes pretty close, about $10,000 a year. And that, again, only about half of childcare centers in Kentucky are high quality, meaning they have 3 stars or higher in the all-star rating. And so I know for a lot of centers, it's really difficult to even be able to afford quality because they can't charge parents what it takes to be able to provide that. So it's really important to know that parents are really struggling to be able to afford childcare. And if you move on to the next slide, what we also have found, particularly through our own research working directly with childcare centers, is that childcare centers are struggling to be able to charge families enough to be able to provide for that. The upshot of this means that because of expiring federal funds that I mentioned earlier, that are going away finally at the end of this month, there are a lot of centers who don't know what's next. Most centers are saying that they're going to have to raise tuition. They may have to cut already very low salaries for their workers. And 1 in 4 said that they may even have to close their doors. So we may see that decline continue once federal funding expires at the end of the month. This is really concerning. And what it shows us is that there's what's referred to as a market failure. When a business can't charge enough to be able to provide the service that they're offering, that means that we need the government to step in to some degree to stabilize that. And if you move on to the next slide, the state did do some. It's important to give them credit. There were calls for $150 million a year to be spent to support Kentucky's child care centers, specifically through Danny Carroll's Horizons Act in the Senate. Unfortunately, that bill did not move forward. And instead, what we got was around $70 million, which created higher reimbursement rates or maintained higher reimbursement rates for providers. It allowed childcare employees to take their kids with them and have those kids covered by CCAP. It also provided some direct assistance to childcare providers by covering background checks for prospective employers and grants for trying out new delivery models, particularly for kids with disabilities. But it wasn't enough ultimately. Sustainability payments, which were direct checks cut to centers based off the number of kids they had and the starting wages in their centers, those were not included. Facility improvement grants were not included. And this pilot project that would have paid centers more for infants that they typically lose money on was also not included. If we move on to the next slide, though, there were a couple of additional things that the state is doing, the executive branch, on top of what the General Assembly provided. First of all, while co-pays are returning, so families pay a certain amount based off their income, the number of kids that they have, and the age of their children. Those have been waived for the last several years. They're returning, but they're returning sort of better than they were before. So specifically, co-pays are going to be capped at 7% of income, which is a federal requirement, but there's a little bit of extra federal money to support that as well. And the state's also going to continue allowing children to qualify for CCAP as long as their household is at the 85th percent of state median income. It used to be much lower than that, and it was based off the federal poverty level, but this was a real improvement. And this chart over here to the right kind of shows where those thresholds are. So that's everything for now. At this point, I'm going to hand it over to Jessica to talk a little bit about food assistance.
Thank you. Hi, I'm Jessica Klein. I'm a policy associate at Kentucky Center for Economic Policy. So I work with Dustin and am a member of the Kentucky Food Action Network. So I'm going to talk to you today about food insecurity and the state and federal programs that help to work on that. Next slide. So a little bit about hunger in Kentucky. Hunger in Kentucky affects over 580,000 people, and primarily that's working families, children, older adults, and people with disabilities. So in Kentucky, our child food insecurity rate is 22%, which is particularly bad because we know that children that face any amount of food insecurity, even a very little amount, can have lifelong consequences to their economic and health outcomes. Next slide. So we do have many federal and state anti-hunger programs. I'm going to just talk about a few of the federal ones that we operate in Kentucky. So those are the Supplemental Nutrition Assistance Program, SNAP, used to be called food stamps, the WIC program, free school lunch, and Summer EBT, which is our newest addition that was made permanent through the Consolidation Appropriations Act. And you can kind of see here the highlighted part is the income qualifications for each of these programs if you want to learn more about those. Next slide. So Summer EBT is our newest program to help end food insecurity for children during summer. So this is again, the first year that it was implemented in Kentucky. It's kind of building off of some work we did during the pandemic, a very successful program known as Pandemic EBT. So building off of that success, we were able to implement this program nationally. Kentucky is one of only 39 states that decided to operate this program. So we were able to reach, I don't have the final numbers actually on how many reached, but an estimated 500,000 kids, and they received about 120 per child for the summer. So next year is going to look a little bit different in terms of the amounts per child because we're doing it based on months that students qualify. This is children that participate in another program like SNAP, Medicaid, or KTAP, or participate in free and reduced meals at their school. So there was applications online that students were able to apply through, or they received it automatically if they participated in some of these other programs. So again, it'll look a little bit different next year, but we'll share more about that as we get closer. Next slide. So a little bit about SNAP or food stamps in Kentucky. So we reach over 600,000 people as of June 2024 through this program. And those receive about an average benefit of $174 for an individual, $370 for a household of two. So again, it's very much a supplemental program to your household's budget for food. The average percentage for counties participating is 13.7% in Kentucky. Unfortunately, though, we only reach about 65% of people eligible for the program. So there are a lot more people that could be receiving this assistance than are currently receiving it. Next slide. One challenge with the food assistance program, SNAP, is that it has work reporting requirements. These requirements ensure that people submit information about how many hours they worked per month in order to receive their food benefits. So that's additional paperwork barriers for Kentuckians to receive SNAP. And what we've really seen from the years that this has been implemented is that it has created barriers rather than changing any employment outcomes. However, there are some new exemptions for having to report work hours. So the three new ones as of last year were people experiencing homelessness, people aging out of foster care, and veterans. We have a really good handout linked here that you can kind of see some of those additional exemptions. Next slide. And one of those exemptions is that counties can be exempt if they meet certain unemployment and economic metrics. So we have many counties in Kentucky that are waived, meaning they don't have to do that work reporting requirement in order to receive their food assistance, which is great. There was a bill last session, 367, that would have removed this county waiver. So definitely want to see this waiver continue so that we can help remove those paperwork barriers to food assistance. So what do you need to know about fraud in SNAP? We do know a little bit about fraud in SNAP. It's less than 1/4 of 1% for intentional violations in this program, and agency error far exceeds that intentional fraud. And there are algorithms that kind of measure fraud in SNAP, and they set up different red flags for people to be accused of fraud. So that's things like forgetting a PIN number, having to go to a store multiple times in a row. All of those can kind of flag you based on your shopping behavior for fraud in SNAP. But ultimately, we have really strong program integrity measures in SNAP. And the biggest piece of fraud that we do see is card skimming. So card skimming is where a skimming device, like the one pictured here, can scan your card and your PIN number, and then people lose their benefits that way. It's stolen from their accounts using that information. So in 2023, there was a federal fix for this that allowed for replacement of SNAP benefits stolen through this method. It's only replacing benefits stolen between October 2022 and 2024. This federal benefit ends in October. We were looking for a federal fix in the Farm Bill. The Farm Bill is not moving as quickly as it should have. It was supposed to be passed in 2023. So way behind on that. But there are state fixes. We could see additional funding for this replacement of skimmed benefits until a federal fix comes. Next slide. A little bit about our Women, Infants, and Children Nutrition Program. WIC. WIC helps to feed pregnant or breastfeeding women, infants, and children under 5. But that also includes kinship care families, fathers, and grandparents can apply. So a little bit of misconception there with the name of the program. And the program actually reaches 106,000 people in Kentucky, and primarily those are infants, so children under the age of 1. So we'd definitely like to see reaching more of those eligible families. Right now we reach about 59%. There are a lot of changes happening in WIC right now, and that's called WIC modernization. Some additional funding has gone into that program to help do things like improve the app, make it easier to find stores and products that can be purchased using the benefits and those kinds of things. So more improvements coming to that program. I will plug quickly a survey at the bottom here. We are looking to hear more from families and people that have either received WIC, worked with families that received WIC, or have any feedback about the program in Kentucky specifically that we could be looking at. So please fill that out if you don't mind. Thank you. Next slide. So resources, help with food assistance. We have a lot of really important resources here in Kentucky. There's even more linked at the bottom of these slides, so definitely take a look there for food assistance. Here I will plug each of these websites. You can get help with the different programs that I mentioned, but also find a local food bank using this map here too. So some good resources to share. And finally, that Kentucky Food Action Network I mentioned at the beginning. We are an advocacy statewide network that works on food in Kentucky. So we help to fight false narratives in the safety net. We work with agencies to make programs better, and we engage in policy and program change to address hunger in Kentucky. So if you're interested in that, please join us. On to housing with Adrian. Thanks.
Thanks, Jessica. So I'm Adrian Bush. I'm the Executive Director of the Homeless and Housing Coalition of Kentucky. Glad to be with you all today. All right, so following up from the spring, we talked about the Supreme Court case, Johnson versus Grants Pass, which asked whether it is constitutional for governments to criminalize homelessness under the 8th Amendment. And unfortunately for all of us, the Supreme Court of the United States said, yes, it is. That doesn't stop us from our work. And I would note that there was a significant amount of pushback here in Kentucky against these cruel and punitive measures for people experiencing homelessness. And so I would just use this as a call to action for all of us to ensure that cities and states turn to effective solutions, not counterproductive and punitive ones. Next slide. All right, following up from last summer, the Federal Housing Finance Administration, which it consists of Fannie Mae and Freddie Mac, and backs many mortgages underwriting multifamily or rental property in the United States. They had issued a request for information on what better tenant protections would look like. This summer, they finally released upcoming policy changes in response to the thousands of comments. And so these changes will include any property receiving a new federally backed mortgage would be required to provide tenants with 30 days notice of any rent increases, as well as any lease term expiration, and a minimum of 5 days for late rental payments. Effective for new loans signed on or after the policy effective date, February 28th, 2025. So these are modest protections. We're glad to see them. From our perspective, FHFA could have gone a little bit further, but overall, yes, this is progress. Next slide. All right. So under both a federal and state perspective, we know that disaster recovery continues to be an issue. And part of the issue is that at the federal level, Congress does not permanently fund the Community Development Block Grant Disaster Recovery Grant Funding, or CDBG-DR. So because of that, every time there are major disasters, you have to go through a supplemental appropriations process, and it takes forever because HUD has to rewrite the rules every time one of these grants are made for the money to actually get into communities and into the hands of people who have been affected. So there is an organizational sign-on letter put on by the National Low-Income Housing Coalition around a bill, the Reforming Disaster Recovery Act, and we are asking organizations in Kentucky to sign this on that would permanently authorize CDBG-DR. And to that end, we have the 2022 CDBG-DR housing applications are finally open for people in Eastern Kentucky who were affected by the flood, and also some of the money that was appropriated through the 2021 disasters for Breathitt County for the floods there. All of that has been lumped in together. So if you know of folks in Eastern Kentucky still displaced, send them to that link. Next slide. All right. Again, from a national perspective, we wanted to lift up that the National Low-Income Housing Coalition, National Housing Law Project, and Tenant Union Federation has released a comprehensive National Tenants Bill of Rights to help shift the balance of power. And some of these rights would include a fair application, a fair lease, freedom from discrimination and harassment, habitable homes, reasonable rent and costs, right to organize, and safeguards against eviction. And this is something that both organizations and individuals can sign on to today, and we encourage folks to do that. Next slide. All right. Covering both national and state, the National Low-Income Housing Coalition released their Out of Reach Report 2024 this summer. And one thing I want to highlight for folks and that we've been highlighting at the road shows this summer is that 7 years ago, when I started at HHCK, Kentucky was number 50, which meant that we were relatively affordable. We weren't affordable for people who are extremely vulnerable, people who need a safety net. But for most of us, the housing market was working. Over the last 6 years or so, we've hovered in the 40s. And now in 2024, we're at number 38. And so housing affordability is going the wrong direction as we are coming out of the pandemic and different protections have lapsed and funding has also been spent down. So what is driving housing to be out of reach? Next slide. All right, we have a housing supply gap. We have a housing shortage. We have had one, but we do have new data on what those needs look like in Kentucky from a statewide perspective for both rental and for home ownership. And I want to highlight that the statewide number is over 200,000 homes. It's pretty evenly split between rental and for sale, but from our perspective at HHCK, you see that biggest gap or that biggest deficit remains with our extremely low income Kentuckians, 0 to 30% AMI, area median income for people who need to rent. So if you're interested in learning more about this, Kentucky Housing Corporation, which has commissioned this study, is having a webinar on this next week. They're doing phase 2, which will get into future trends, what we can expect it to happen 5 years from now. Next slide. All right. So recovering from the legislative session and trying to address our housing supply and other issues, the legislature did create a Kentucky Housing Task Force to study and review the current and future policy needs of the state. It will meet monthly through November. Next meeting is in September. You don't have to come to Frankfurt, but you're always welcome. These have been really well attended because people are very interested in seeking housing solutions. They will make recommendations by November, and legislators can use this to inform 25 and 26 legislation. Next slide. All right, House Bill 5, implementation. As an update from the spring, it went into effect on July 15th. We are watching its implementation closely across the Commonwealth, and you can help. The bill does all of those things listed on the slide, basically tickets and fines and punishes people sleeping out and moves encampments around. And we would like your help in monitoring its implementation to try to minimize the negative impacts people face and lift up what is actually happening on the ground to policymakers. And with that, oh, I have one more positive update, and that is minimizing barriers. So from the legislative session, we got no cost IDs through the revenue bill, and we also have no cost birth certificates through House Bill 100, which was sponsored by Representative Susan Whitten from Louisville. And both of those things help people who are unsheltered, who are experiencing housing insecurity, reestablish identity and residency to help them get reconnected to the community, find housing, apply for jobs, schools, etc. We held a training in August. It was online. It was recorded. You are welcome to listen to it. And then we also are asking different homeless service providers across the state whether you can help clients access identity and residency documents. So check out the links at the bottom of the slide. And with that, I think I'm really done and can hand it over to Dr. Schuster.
Thank you, Adrian, and always time for good news. So I'm back again talking about behavioral health and particularly about our waiver updates. Next slide, please, Alex. So we actually had some good news, relatively speaking, for behavioral health budget allocations. So the community mental health centers had got $18 million to cover their pension costs. Big increase in the new waiver slots or placements. I'm going to talk more about the waivers for people with severe mental illness and substance use disorders. Very important, and I think Dustin referenced the need to get frontline workers to deliver the waiver services, and there's $94 million over the next 2 years to up the salaries for those frontline workers. Tim's Law was passed in 2017. It's an assisted outpatient treatment program for those with severe mental illness, and we got some money to continue to keep it going and to expand it to the rest of the state. Fortunately, we got continuation funding, not new funding, but at least to keep the school mental health professionals in our schools. And then a new grant to address suicide among farmers and agricultural workers. That's one of the groups that is most vulnerable right now. Next, please. So we've been working on Medicaid waivers for two populations that have never had a waiver before. One are folks with severe mental illness and or substance use disorders, and the other are for people with either one of those behavioral health disorders who are incarcerated. So we have a 1915I state plan amendment. We thought it was going to get approved by CMS in September. It sounds like it may be a little bit delayed, but one of the key points, and it's I appreciate following Adrian, because one of the things most needed by people with severe mental illness is what we call supported housing, not just a roof over their heads, but housing that comes with wraparound services to make sure that people have access to their medications, are reminded about taking them, have access to their therapy and recovery programs and so forth. So fingers crossed that this is really going to happen before the end of the year, or at least be approved before the end of the year. The other is that typically Medicaid benefits are suspended when somebody is incarcerated in jail or prison or at a DJJ facility. So we have been working for about 5 years with CMS, and this new reentry waiver, it's called now, has now been approved by CMS, and it allows treatment that Medicaid will pay for to begin in the prison or in the DJJ facility 60 days before release, and then to continue with the individual as they move into the community. So we think this is huge, and we really think that this will go a long way toward ending recidivism in this population and make sure that people have what they need as they get into the community and not wait until they're out there and then start looking around for treatment and so forth. So very excited on both of these. Next, please. So Dustin talked about the home and community-based waivers and the new slots or placements. I hate the word slots because it makes it sound like we're talking about widgets, and we're talking about people here. These are people. Each one of those is a placement for someone to get these waiver services. So they use the slots, but these are people fundings. And I think I misspoke earlier. Dustin, you asked about, it's the home and community-based waiver. It's the Michelle P. waiver. It's the supports for community living. And then it is the ABI long-term. I think I said model 2, but I was in outer space or something. It's the ABI long-term. That's the good news. The bad news is that the waiting list is growing faster than those new slots can be filled. And so when we get to the end of the 2 years and we have 1,925 new Kentuckians who have waiver services that didn't have them before, we will probably still have a waiting list that's over 14,000 for these waivers. So the advocacy is going to have to pick back up again for the next funding cycle. In the meantime, we're monitoring the Cabinet for Health and Family Services to make sure that they're moving along to do the waiting list counts, the assessments, and the management changes to fill those new slots. Next, please. I want to highlight this. I get asked so many times when we're on the roadshow or afterwards, or people know my name and number and they call me. This is the best single resource to find help for yourself or for someone in your family. And it's findhelpnow.org/Kentucky. This is updated almost on a daily basis, certainly weekly, by the providers themselves. And it has a million different categories. You could look for mental health treatment or substance use disorder or recovery housing or naloxone or just some basic learning materials and information facts. But it will tell you in a very precise way in the community where you need services, who's providing that particular service, what the payment mechanisms are, if any, whether they take insurance, whether it's Medicaid, whether it's Medicare, and how to go about getting a bed or a treatment placement there. So I just highly recommend this. It's put together by all those people you see there at the bottom. So it's a public-private partnership, if you will, and it just is an outstanding resource. So spread the word about that, please. Next, please. So on the not so good side, September is Suicide Prevention Month. So I just want to draw attention to the fact that we don't do real well here in Kentucky. We lose a lot of people to suicide. In a 5-year period, we lost almost 4,500 Kentuckians, most among ages 35 to 54. And of course, firearms are the most common means. So there's been increases in almost every category that you could think of: adolescent and college age Black males, 55 and older, particularly white men. As I mentioned earlier, farmers, and this is a great resource here. Raising Hope KY is dedicated just to working with farmers, and actually Future Farmers of America is very active here. We're trying to get to the youth. And then be particularly sensitive to LGBTQ youth. They are not more prone to suicide because of their sexual orientation, but because of the way that they are often mistreated or stigmatized. And the Trevor Project is an excellent resource. Next, please. So I hope you all know about 988. We've had it now for, we had our second birthday in mid-July. Those calls are answered locally. I cannot tell you how important that is, that we're leading the nation and being able to answer those calls by our community mental health centers in the local communities. So when they get resources to the person, they're local resources. We've seen a 40% increase in calls since it was launched. The answer rates are going up. The times to answer are going down, which is good. Fewer than 2% are referred to law enforcement or ambulances. There's kind of a fear factor out there that people are afraid to call if they're in crisis because they're afraid the police are going to pick them up and take them to jail or something. And that's really not what's happening. You're going to get a trained person to talk with you and to help you to sort out what you need immediately. We are seeing a growth in the number of crisis call takers. There's a whole training program through the community mental health centers. We've added, or we are adding text and chat. And then they've also streamlined, if you're a veteran and are in crisis, or you're calling about a veteran in crisis, hit 1 if you need Spanish, hit 2 if you're calling about an LGBTQ issue, hit 3. So just have people reach out. 988 is the way to go. Next, please. And the other question I get so often, Dr. Schuster, how do I know if I need help or if somebody that I am caring for or somebody I know needs help? So you need to keep an eye on yourself or a loved one and look for changes in behavior, eating or sleeping either too much or too little, irritability, easily crying or feeling sad, increased use of alcohol or other drugs, lack of concentration, forgetting important things or dates, not having the energy or desire to keep up with exercise or routines, isolating from other people, not engaging with school or work. And if they persist for, I've got 2 months here, if they really persist in a big way for a month or so, check in with a primary care provider, call your local community mental health center, call 988 and ask somebody whether they think that this is something that needs to be addressed. Screenings, confidential screenings are available online at the link there with Mental Health America, and they can give you, that gives you some baseline or feedback. When in doubt, reach out for help. You're better off catching it early than waiting too long. So you know yourself, you know you can only be a help to other people if you're healthy yourself. So I wish you good mental and physical health. And with that, I will turn it over to Ms. Priscilla.
Priscilla, if you're talking, we can't hear you.
Can you hear me now?
Yes.
Right.
Well, so glad that happened for so long. Hi, everyone. I am Priscilla Easterling. I'm the Director of Outreach and Enrollment for Kentucky Voices for Health. And today we're going to go over Medicaid and Marketplace updates with a little emphasis on open enrollment, which is quickly approaching. So next slide, please, Alex. All right, so Medicaid renewals, we have been talking about those for well over a year now. So now the Medicaid renewal cycle, all adult renewals are back to that normal annual renewal cycle as of the end of May. The first batch of the regular renewals were due May 31. And so now adults are just in that regular routine. June, there's still that 90-day reconsideration period. And so for June, July, and August, all of those months of adult renewals, those are in their 90-day reconsideration period. That just all, what that really means is that if for some reason folks did not respond to any request for information, they did not submit that documentation, they're still in that 90-day period. All you have to do is submit those requested documents, and assuming you're still eligible, the state will be able to reinstate coverage back to the day of the loss of coverage. So that's for adult renewals. For child renewals, those have yet to begin yet. We know that they're going to start soon. The state is still waiting on some approval for CMS for their renewal plan for when they start. But right now, the big takeaway is to make sure that all contact information is up to date and Connect. You can log in to Connect self-service portal to check your case information and update it. If you need any help doing that, you can always call the Connect hotline and double check that your information is updated that way, or reach out to a connector for help. They can help take care of that for you, meet with you in person, and sort of walk through that entire process with folks. And you can also always ask your doctor's office to check the KY Health Net portal. So when you go to the provider's office, just make sure you can ask them, hey, can you check my renewal status? And they'll be able to pull that date for you to make sure that you know when it is. And then we do still have an explainer available that is now available in English and Spanish, and those are linked there. And I see a question in the chat. Does retroactive coverage mean dates of service during the review period will be paid? Yes, absolutely. That's exactly what that means. When coverage is reinstated back to that date of the loss of coverage, any bills that were accumulated during that time, those can be billed to Medicaid once coverage is reinstated. Going back to the slides, so here are a couple of examples of the notices that all members get sent. With that notice of eligibility, it typically is just a notice saying you've been extended for another 12 months, and you don't have to take any further action, but also double check, read it, make sure that it's not asking for anything. For the RFI, that's usually a request for information, usually for income, but we've also seen for residency or citizenship or various other issues or various other options. It's really important, whatever information that they're asking for, please submit it by the deadline, by the due date that is listed out on that notice. And for the renewal packet, that renewal packet has a summary of all of the case information on it. You just need to go through, double check that all the information is correct. If there's anything different, mark it. If there's anything that has changed, mark it and pin on that renewal packet and send it back. But when you get these, make sure you read them, understand what's going on. If you need any help understanding that notice, please reach out to a connector. Next slide, please. Okay, and so this is a little bit more of what we were talking about. If you've lost coverage, the first thing to do is always to go into Connect and update your application and make sure your information is up to date and accurate. If you have any problems with that, please reach out to a connector. You can, or call the call center. You can do that on connect.ky.gov. And if you've lost coverage, you can submit those documents and still have your coverage reinstated. If you submit your documents and update your information and they still say that you're ineligible and you think that you're still eligible, you still have the right to file an appeal up to 120 days. And you can request a fair hearing. So there's also a hyperlink for how to do that. I also recommend working with a connector who can walk you through that whole process. So next slide. This is just an overall view of the Medicaid enrollment since the unwinding began last year. We've seen it very much trickle down. People are still enrolling. So, we've seen parts where there's been a little bit of a plateau between like November 2023 and April 2024. But now it's sort of subtly dropped a bit over the last 4 or 5 months. We still keep a track of this. So Medicaid is open all year round. So we know folks will still be completing those applications, but we like to just make sure you can see that data. So next slide. We've still, over the last year and a half, we've continued to track any renewal issues where folks have had problems completing their renewal, or they've been receiving termination notices, even if they should not. Some more recent issues that we've heard about are some children receiving termination notices. We know that RFIs for residency for children and for families, they've been ticking up since maybe June, if not a little bit before that. RFIs for residency are a valid RFI. You do have to satisfy those. If you have any problems submitting that document, that is an issue that we would like to talk about. That's an issue that we want some more information about. If you're just having any problems satisfying that RFI for residency. And then we've also been hearing about children with SSI income potentially losing coverage and receiving termination notices. Those are just 2 examples. If you see anything else, or if you know other folks who have lost coverage, or they're receiving duplicate notices, one says one thing, one says the other thing. One, you're approved, one, you're terminated. We've also seen that quite a bit. We do work directly with the state to help troubleshoot those cases and get those resolved. So if you have clients that you're working with that they've lost coverage, or there's something confusing about their case, please don't hesitate to reach out to me. My email's there in the slides, and also put it in the chat, but just email me directly, give me a call, let me know, and we can work with the state to resolve those cases individually. Okay, next slide. And just as a reminder, CMS is holding monthly stakeholder meetings. They're the 3rd Thursday of each month at 11 a.m. And they have sort of broadened their scope. So when they first started, they were primarily focused on Medicaid renewals and the unwinding and all of the pandemic-related unwinding of policies and flexibilities. Now they've broadened scope. They've broadened their scope quite a bit. And so now they're focusing on just big updates within Medicaid. There have been a number of rule and policy changes in the last year and a half, 2 years, and will continue to be more. And so this is an opportunity to hear directly from the state as they update us about all of those policies and what those implementation plans look like and what they're working on. So it's a really great opportunity to hear directly from the state. The link is there. The next meeting is September 19th, and you can register at that link as well. Going. I will get to this question in the chat in just 1 minute. So keeping rolling. So for health insurance, open enrollment, Medicaid, again, it's always open for enrollment. You can go to connect.ky.gov or call the call center and apply for Medicaid at any time of the year. The big change for this year is that there is no open enrollment for Medicaid this year. Typically, that's been the time where members can change their MCO during that open enrollment period. But now for this year, that has been eliminated. And so you can change your MCO at any time, at any month from now until December 2024. So if you need to do that, absolutely. And then for the marketplace side of things, there is a more specific open enrollment period, and that is the time when you can shop and compare plans on Connect. That runs November 1st through January 16th this year. And you want to make sure to apply by December 15th if you'd like coverage to start January 1. If you currently have marketplace coverage, they do their best to do a passive enrollment where they match you to your current plan, the version of your current plan that exists for 2025. If there are any plans that they can't do that sort of passive renewal, passive enrollment, That's where they will send you a notice saying, hey, your plan does not exist for 2025. You do need to take part in open enrollment. Here are some other comparable plans to check out, or make sure to go to Connect and do that. Again, I always recommend folks work with a connector, or for Marketplace, if you'd like to work with an agent and shopping for a qualified health plan, that's also an option as well. And if you need local help, connectors are available in all 120 counties, and there are also SHIP coordinators for folks who need to get assistance with Medicare. And that open enrollment for Medicare runs the October 15th through December 7th. Okay, next slide. So a couple of Marketplace updates. Yes, okay, so a couple of Marketplace updates. CareSource is going to be leaving 27 counties for 2025. So here's a list of those impacted counties right there. The total, there's going to be about 3,000 members who are going to be impacted or going to lose their CareSource plan. KHB Connect is going to send a direct notice to those 3,000 impacted members, letting them know, hey, CareSource is leaving, they're not going to be an option. And they will, also connectors and agents will be sent a specific list of any of their clients who are in that coverage area, so that they can do that direct outreach and help make sure that folks know that their coverage is going to have to change for 2025. Good news, Molina Passport is expanding into 5 new counties: Boyd, Greenup, Henderson, Lincoln, and Rockcastle. There will be a new dental provider, Paramount. And then there are 2 new SEPs that are going to go into effect in the next couple of months. One, DACA recipients and a couple of other immigrant eligibility categories will be eligible for a special enrollment period beginning November 1 to enroll in coverage for December 1. And then there will also be a new pregnancy as a special enrollment period that is going to be integrated into Connect beginning January 1. So that's also really exciting. And then there are now the paper version. It's a PDF on the website that you can print it. The paper version of the Connect application and all of the appendices are now available in 15 different languages. They've really ramped up the number of translated materials, which is very exciting. So that is also available at that link, and it's on the KHB website if you need to find it that way. So right now it's not open enrollment. Again, that starts November 1, and that is specifically for coverage that starts January 2025. If you need coverage before then, you have a life change, you move, you lose your insurance for some other reason, you can still get coverage outside of an open enrollment right now. And that's through a special enrollment period. Here's a full list of the special enrollment periods that are available. We also have an explainer about how those special enrollment periods work. I want to highlight again that new pregnancy SEP that's going to be available beginning January 1, 2025, and the change in eligibility for financial assistance. That is also going to be, that is where DACA recipients being eligible, they'll be newly eligible for the special enrollment period. And so they will be able to get enrolled for December 1 coverage. All right, so next slide. So I see another question in the chat. Yes, to take a quick pause, the unsubsidized premiums in private insurer marketplace plans such as Silver plan rising. So we don't have the overall percentage of what the rate increase is going to look like yet. But we know for just about every county except for Henderson County, very specifically, for every county, all marketplace plan pricing is going to be going up some percentage between this year and next year. The good thing is that we still have those expanded ARPA subsidies right now, which even for folks who do not receive a premium subsidy, it helps make up the difference for, it helps cover specifically for, sorry, I mixed all of that up. So across the board, all plans are going to be going up. For folks who do have the subsidy, they'll have that additional, the subsidy will rise to cover that difference, so that the percentage of that expected contribution, individual contribution, is still going to stay the same. The premium tax credit will just adjust to cover that difference. For folks who are not receiving a subsidy, they will see that price increase across the board, and regardless of the category of the plan, and that'll happen legitimately in every county except for Henderson. If you are enrolled in a plan that doesn't have a subsidy, this might be an especially good year to make sure that you're really shopping for coverage, to make sure that you're getting the best bang for your buck, the best coverage for what you're paying for. Okay, so back to the slides. They're a fix for the families. A friendly reminder, last year there was a change in the rules for who's eligible for premium tax credits. Families are now eligible for those, so make sure that you shop, make sure that you really do the math about, your employer-sponsored plan and what that cost is going to look like for you, for the employee, plus to add family members. And make that comparison to shopping on the marketplace, because it might be more affordable. And if you've not looked at the marketplace before, this is a great time to look at it now. So make sure to check that out. And here's a great explainer about how that policy change works. All right, next slide. And a friendly reminder, never, ever, ever Google health insurance or find health insurance, because you will get nothing but scam calls and you'll get a ton of them. If you're looking for health insurance, please start with connects.ky.gov. There are 4 insurance plans: Anthem, CareSource, Passport, and WellCare. Those are the only plans that are available on Connect that do cover the essential health benefits. So make sure to check those out. And if you get any scam calls, just hang up on them. You don't have to deal with it. Next slide. Perfect. With that, I'll turn it over to Emily.
All right, thanks, Priscilla. And thank you all for staying on with us for this 90-minute webinar. I hope it was a lot of good information. Just to wrap us up, we always like to include a section at the end for additional resources that you can use when you're supporting your communities. So I won't go through all of these, but let's go to the next slide. Just a couple more webinars and events for you to put on your calendars or share with your colleagues. And then let's go to the next slide. The election guide that was mentioned earlier on in the call. And one more slide. Our explainers. These are great resources to hand out in your community, to share electronically, and we keep them all updated in English and Spanish at kyloop.org. So make sure to take a look at those, particularly the immunizations through the lifespans, which was just updated. It's ready for the fall. If you all have any suggestions or requests for other topics, please let us know. With that, I'm going to say thank you all again for joining us. Please be on the lookout for the email that has the recording, the slides, other materials, the evaluation. We'd love your feedback. And we hope to connect with you all again soon. Thank you all. Bye.
Thanks. Bye-bye.